Welcome to Ayur Times. Today, we're diving into a lesser-known but fascinating application of Mahanarayan oil, its internal use as a potential remedy for osteoarthritis. Most people are familiar with Mahanarayan oil as a massage oil for joint pain. But what's truly remarkable is how effective it can be when taken internally. This traditional Ayurvedic remedy doesn't just mask symptoms, it works on a deeper level, nourishing bones, ligaments, tendons, and synovial fluid to address the root causes of joint pain and degeneration. From the Ayurvedic perspective, osteoarthritis is primarily caused by a Vata imbalance. Vata governs movement, and when aggravated, it leads to dryness and cartilage deterioration. Mahanarayan oil is specifically designed to pacify this Vata imbalance. It protects joints from further damage and improves the quality of synovial fluid, the natural lubricant within joints. This approach doesn't just relieve symptoms. It aims to restore joint function and balance, potentially offering an alternative to invasive procedures like knee replacement surgery. So, how is Mahanarayan oil taken internally? The recommended dose is 5 ml twice a day with warm milk. Most people notice relief within the first week. Common improvements include reduced pain, less stiffness, and increased flexibility. For best results, combine internal use with external massage. Apply Mahanarayan oil to the joints for at least 40 minutes. This synergy significantly enhances the therapeutic effect. If you're considering joint surgery, this holistic therapy may be a path to explore first. Enhance Mahanarayan oil's therapeutic effects by combining it with a herbal mixture. 1000 mg ashwagandha, 500 mg each of mustak, shatavari, gokshura, and shalaki, 250 mg purified gugul, and 125 mg trikatu churna. Thin individuals should take it with milk, while those with obesity should use warm water for optimal absorption. Although this treatment is powerful, it must be used responsibly. Internal use of Mahanarayan oil should only be done under the supervision of a qualified Ayurvedic practitioner. They'll assess your constitution, health condition, and current medications to tailor the treatment safely. Do not self-medicate. A trained expert ensures proper dosage, effectiveness, and most importantly, safety. If you found this helpful, consider subscribing to the Ayur Times channel. And if you have thoughts or questions, we'd love to hear them. Please leave a comment below. Until next time, stay balanced and be well.